Good morning, ma'am. I am Hazel Andy Banzon, your Level 1 nursing student of Notre Dame of Marble University. So today, I will be performing the return demonstrations on comprehensive physical assessment. So, comprehensive physical assessments are completed in such instances as the client's first visit to a healthcare or healthcare provider to obtain an overall impression and baseline data. When using a head-to-toe approach, some body systems may be assessed in combination. So the following are the purpose of procedure is to obtain an overall impression of client's health status and to obtain baseline data to utilize the focus assessments technique on systems that might have potential problems. It also have some special considerations. It is a wise to break up the assessments into parts of all is to into parts and to allow both you and the clients short rest periods. There is more than one correct way to integrate the entire health history and physical examinations. However, it is a health um, it is a important to develop a consistent and logical routine to avoid omitting significant data collections from our assessment. So some population groups may have assessment results that are normal, but we will be deviations from the usual findings. We the nurse must be aware now with these deviations. And now we're going to prepare the necessary needed equipments and paraphernalia. This saves times and effort. So we have here the pair of clean gloves, and also we have here the mirror or camera. Let's assume that this is the mirror. And also we have here the ruler or a ruler with centimeter marker, and also the skin markings or ballpoint or ballpen with ballpoint point, and also we have here the pen light, and also we have here the stethoscope, and small cup of drinking water, and also we have here the newspaper or magazine, and we have here the cotton balls, and we have here the jot down notebooks and watch with the second hand, and also um, it's and for the substances of smell or and taste, we have here the soap for smelling, and we have here the the substances for the taste. We have the salt and sugar, and also we have here the metric tape and tongue depressor, and also we have here the kidney basin with paper lining, and also we have here the cotton applicator and or cotton buds, and also we have here the paper clip, and also we have the last is tray. And now I'm going to perform the hand hygiene to avoid the spread of microorganisms. And after performing the hand hygiene, we are now going to introduce ourselves and verify the client's identity to explain the procedures that we will be doing to alleviate the anxiety, and also to ensure that the right procedures is for the right patient. So, good morning, ma'am. Ako gali si Hazel Ann Banzon, nursing students of Notre Dame of Marble University. Subong gali nga adlaw, ma'am, mag-perform ko sang comprehensive physical assessment sa imo. Aring procedures, ma'am, medyo malaba-laba ini siya nga procedures, and as we go in this procedure, may times na nga hindi ka maging komportable, pero sikapon ko man nga matasigan kag makuha ang tamang nga resulta. Okay lang to sa imo, ma'am?
Yes.
Then we have to provide the privacy for the patients as we close the doors and the windows. For the patients maybe feel relaxed. And after that, we're now going to don the clean gloves to protect ourselves and the patient from across the contamination. Then after done glovings, I'm going to perform first the general survey. So I'm going to observe the appearance of the patient since it gives the overall impressions of the patient's profile. So just by looking the patients and observes, we will going to be note the significance finding. Like for example, the body postures of the patients, the way she sit and how comfortably she be sitting. So, throughout the examinations, we have to assess the skin color and vibrations, textures, temperature, turgor, edema, and lesions. Normal findings will be uniform skin color with slightly darker exposed the areas, and the temperature and varies depending on area being assessed. So the turgor is often used to assess hydration status. So ma'am, okay na mo kung i-assess ko ang skin turgor mo ma'am. May check ko. So as I assess the patient, it has a normal findings, and the temperature of the skin is warm, and the turgor is normal. So now we're going to teach skin self-examinations to our patients to promote independent and will help the patients to detect the changes of her skin. And so with the use of the mirror, we can teach the patients to assess her skin. So, ma'am, kailangan mo mabalaan ang imong nga so kailangan mo mabalaan kung paano mo i-assess ang imong skin gamit ang salamin. Pwede mo i-check ang imong nga back, ang imong kamot, since makita mo man ang imong kamot, pwede mo i-check ang imong kamot if there's skin changes or these deviations. And gamit ang mirror, pwede mo man nga i-check ang imong likod or ang dalo sa imong by using the mirror. So pwede mo ma'am. Yes po. Now, we're going to assess the head and face. First, we have to inspect and palpate the head and notes the consistency, distributions, and color of the hair. So, ma'am, first mag-inspect ako sa inyong ulo kag sa inyong buhok, ma'am, ha? So, improve your hair po also. So, okay. Hair should be evenly distributed. Exemptions are normal balding patterns common to the men or personal of advanced age. Hair thins with age. So as I can see, first we're going to palpate. Ma'am, palpate lang ako, ma'am, ha? Step, ma'am. Okay. With the patient, the hair is evenly distributed and the consistency of the hair is normal, and as I palpate, it's non-tender. And now we're going to observe the face for symmetry and the features and expressions conditions of the skin. So facial appearance varies by gender, age, and racial and ethnic group. However, there should be symmetry of features and movements. So by doing this assessment, now we're going to stand in front of the patients and see for the symmetrical. So, ma'am, I'm going to check your head. Okay. So, the facial of the patients is symmetrical and the skin conditions is normal. And so now we're going to assess the cranial nerves number 7. So, the client should be smile, frown, show the teeth, blow out cheek, and raise eyebrows, and tightly close the eyes. So, ma'am, can you please smile? Can you please frown? Can you please blow your cheeks like this? And can you please raise your eyebrows? And now, mom, I'm going to, first you're going to close your eyes and just close your eyes tightly. So, and I'm going to open it like, just close it tightly. Okay. Normally, the client can follow the instructions. She has followed all my instructions and all movements, all my instructions, and of course, all the movements should be symmetrical and against resistance. And inability to follow the instructions may indicate the injury and cranial nerve 7. So now we're going to assess the cranial nerve 5. We're going to test the light sensations of forehead, cheeks, and the chin utilizing the cotton. And we're going to assess the patient's light sensations. So, ma'am, pwede mo i-close ang imong nga mata, ma'am. Maghaba ka sang nawang if mabatsagan mo ang if may nabatsagan ka nga na nadapos sa imong itsura, ma'am, ha? Haba ka lang sa naw. So, please then close your eyes. Now. 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 So the light sensations of the patients is intact, and of course, always remember that do these procedures by utilizing all the phases randomly. And now we're going to proceed to the sharp going to proceed the assessing of the sharp sensations of the patients utilizing the tip of the paper clip. We're going to utilizing the tip of the paper clip, going to the same procedures. So, ma'am, again, please, pwede mo i-close ang mata mo. Then, maghamba ka gyapon sang now. If may batyagan ka nga sharp sa nimo nga mata. I mean your face. Please close your eyes po. Now. 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 Okay. The patient's sharp sensation is intact, and that is normal findings. Next, we're going to palpate the temporal arteries for elasticity and tenderness. So it must be elastic and non-tender. So ma'am, I'm going to palpate your temporal, which is this part of our head. I'm okay na sa inyo, ma'am, if I palpate yung temporal mo, ma'am. Okay. So, as I palpate, the temporal artery is elasticity. And bago gitouch ko ba siya, ma'am, masakit? Hindi. So, as I palpate, the temporal artery is non-tender. So, that is a normal findings. Next, we're going to palpate the temporal mandibular joint. Normally, the jaw should have full range of motions, and temporal and masseter muscles contract with bilaterally and asymmetric strength, and moving the jaw indicates injury of the fifth cranial nerve. So, ma'am, today I'm going to palpate your temporal mandibular joint. This is yung pangani po, ma'am. Okay na ba kung ipalpate ko, ma'am? Okay, so, ma'am, can you please, ma'am, i-open mo daw ang mga jaw, ma'am. Try to open and close po ang jaw niyo po. Kung ipalpate ko ba siya, ma'am, masakit siya, ma'am. Okay. So the temporal mandibular joint is non-tender, which is a normal findings. And now we're going to assess the eyes. First, assess the visual functioning using the newspaper or magazine. So we are going to place it in 14 inches away from our patient, and let her read it. And because adults read the newsprint easily as a distance of 14 inches, recorded as a 14/14 OS, OD, and OU. So, ma'am, so we're going to read this. We're going to use this magazine or newspaper to for the patient to read it. So, ma'am, um, utilizing your left eye, and you read this magazine utilizing your left eye, right, and then your right eye, and then both of your eyes. So first, you're going to close your right eye. Then ituturo ko po kung ano pong basahin niyo po. Basahin niyo po po.
What a sad life it would be we allowed the stresses of work take over our life. In order to breathe, we have to do what we love.
So, sa left eye naman po yung cover niyo, ma'am. And then, basahin niyo po ito.
I love my career very much. I love the work. It's really the basic that I love. Singing, acting, and hosting.
So, yung both of your eyes naman po. Ito po.
I also never stop learning. I think that the key to it is just always learning something new and being open to learning whatever people teach.
So, the near vision of our patient is intact, which is that is a normal findings. Now we're going to inspect the internal eye of our patient. So we have to stand in front of our patient and to note the parallel alignment, and the eye should be clear and bright. And also we're going to note the presence of the contact lenses, and there should no crusting and infestations of the eyelids or eyelashes rather, and edema and lesions on eyelids. So can I inspect your eyes, ma'am? So as I try to inspect the patient's eyes, it's symmetrical and there is no crusting the eyelashes and edema on the eyelids. So which is that is the normal findings. Now we're going to test the pupillary reactions to the light accommodations. We're going to note the pupil size and the quality. First, we're testing the patient's pupillary reaction to the light. Utilizing this pen light. So ma'am, pwede diretso lang imong matatulog sa far end sa ating nakata, ma'am. Look forward lang po. Diretso lang tulog sa kwan, ma'am. Di lang pag ano. So, and we have to note the direct and the consensual reactions of the pupil. And so, for the accommodations, we're going to use this utilizing this pen light and place it in front of the patient. So, ma'am, aring pen ninyo ay butang ko siya sa in front ko, ma'am. I-move closer ko sa imo siya forward, then I'm going to push it far away. Just ano lang, ma'am, nang tulog ka lang sa pen, ma'am, ha? Sige. Nang tulog ka lang ng pen, ma'am. So the eyes are converging as move the pen towards and diverge as we move it far away. And now we're going to assess the corneal reflex of the patient. So we're going to shine light in the eyes and notice the positions of the light reflections on the cornea, and light should be seen symmetrically on each cornea. When asymmetrical corneal light reflex occurs, suspects weak and extracellular muscles or strabismus. So ma'am, I'm going to light your eye. Just again, ano lang po, just look at the far away from the room. Nang tulog ka lang sa ano yun. Di ka magtulog sa just look at the ano lang po, at the room po. So the light reflecting is symmetrical, which is that is a normal findings. Now we're going to assess the ears. We're going to inspect the auricle, targus, and the lobule. Normally the color should be the same as facial skin, and also we're going to inspect the population and note the level at which the superior of the auricle attaches to the head. With relations to the eye, auricles should be aligned with the outer canthus about 10 degree from vertical. So ma'am, mag-assess po ako ng ears niyo. I'm going to inspect your ears po. So the ears, so the superior aspects of the ears is in the line with the outer canthus. The eyes and both are symmetric. So which is the normal findings. Now I'm going to palpate the auricle and mastoid process. We're going to gently pull the auricle upward and downward and then backward, and then we're going to recoil. And after that, normally auricle should be firm, mobile, and non-tender, and also the mastoid process. So ma'am, ipapit ko lang yung mga ma'am ha, auricle ma'am ha, by pulling your ear po. Hambal ka lang ma'am kung hindi sakit ma'am ha. Masakit po?
Hindi.
Ipabutungan ko pa dali ma'am ha. Masakit po?
Hindi.
Bitungan ko backward ma'am. Masakit po?
Hindi.
If i-close ko to ma'am, masakit po?
Hindi.
Okay. So the mastoid process and the auricle is non-tender and mobile. So which is that is the normal findings. And now we're going to proceed to the test hearing by performing the watch tick test. In this assessment, the patient will cover the opposite ear and being tested and hold ticking the watch within the 5 inches from ear, and we're going to know the patient's ability to hear the sounds, and the patient should hear the tick of the watch and each ear at a distance of 5 inches. So, ma'am, mag-test lang ako sa inyong ma'am ha, sa ear, ma'am ha. I'm going to place this to your ear in 5 inches po. By covering your, while I'm doing this, ma'am, from your ear, can you please cover your left ear, and then after that, after hearing this, I'm going to proceed into your left ear po. Just tell me kung naririnig niyo po ang pag-tick ng watch po. So sa left naman po. So the clients are hearing utilizing the watch tick test, which is intact, and that is the normal finding. And now we're going to proceed to the test hearing performance. Hearing test rather. We're going to perform the whisper test, and the patient should be covered the opposite ear being tested, and about 1 to 2 feet behind of the patients, and whisper. Note the patient's ability to hear the sounds, and the patient repeats most words whispered in each ear at the distance of 1 to 2 feet. So, ma'am, tayo ako. So, ma'am, I'm going to stand here behind your back. By covering, I'm going to whisper po. Just cover. First, we're going to cover your left ear po. Your right ear po. Cover it. Ano niyo po yung right ear po. And, sundin niyo lang po yung sinasabi ko, ma'am, if naririnig niyo po ako. Bag.
Bag.
Dog.
Dog.
So, okay, ma'am, sa left ear niyo naman po. Chair.
Chair.
Ballpen.
Ballpen.
Okay po. Pwede na po kayong umupo pa. So, the hearing test of the patient is utilizing cover the both of the ear is intact, which is the normal findings. Next, we're going to do is to inspect and palpate the external nose for tenderness. So, the nose size and the shape and the symmetry, as well the middle placement. So the shape symmetrical and the consistency with the age, gender, and race, ethnic group. There should no nasal flaring and drainage as well as we inspect. So, ma'am, I'm going to stand in front of you. So I'm going to check your nose. Okay, so now we're going to palpate the external nose for the tenderness. So, ma'am, as I touch, masakit po ba? This side po, masakit din po ba? Okay. So as I palpate the external nose of our patient, the nose is non-tender, and which is the normal findings. And then we're going to check the patency of airflow through the nostrils. So we're going to include 1 mirrors and note the mobility of the cartilaginous of the portion, which should be slightly mobile, and as we palpate, it should be non-tender and no masses. And we're going to ask the client to breathe and not occlude mirrors. So, ma'am, ma'am, I'm going to assess we're going to occlude your nose skills po. And then I'm going to assess po if if adequate ba yung pagpasok ng hangin or paghinga niyo po ng po. So first, before that, we're going to start in the I want you to breathe po, ma'am, if adequate po talaga yung paghinga niyo po. So I'm going to start here at the right side po. Maghinga na po kayo ng normal po. Okay, may nararamdaman ako ng hangin na lumalabas. So, sa kabila naman po, ma'am. Try to breathe normal po. Okay, ganun din po sa kabilang side po. So, I can feel the air and flow of the flow as check the patency, and I can check the patency of it, and the cartilaginous portion is slightly mobile and non-tender and no masses present. So that is the normal findings. And then we're going to include each nostrils and ask the client to smell different aroma to check the cranial nerve 1. So normally the client is able to distinguish different aroma from each nostril. So ma'am, again, I'm going to assess po. I'm going to assess your occluded nostrils po. By distinguishing the different aroma, malapit po sa inyong ilong, then identify niyo po kung ano po siya. And by these procedures, you're going to close your eyes po. And then identify the aroma that I'm going to smell po. Okay. So, ma'am, please close your eyes po. And I'm going to close your nose po, and at the right side po. Then, identify po kung ano ba po. Sabon. Okay, that is correct. And, ito po, ito po. I'm going to close this and identify niyo po kung ano po. Yes. Tama po kayo. So, so the patient's cranial nerve is intact, which is a normal findings. So now, we need to transilluminate the frontal sinuses. So we need to shine the light up the upward under eyebrow of our patients. Normally red glow are noted above from the eyebrow. So, ma'am, again, I'm going to use this pen light. I'm going to utilize this pen light and I'm going to shine up your under your eyebrow to shine light up. Ari siya nga procedures na hindi siya masakit. Pero kung masakit lang, hambal ka lang ng ha. So, I'm going to place it to your eyebrow po ng ha. So, masakit siya, ma'am. Sandali na. So there's a red glow above the eyebrow, which is a normal findings. And so now we're going to change first our gloves and to inspect the lips and the teeth. Now we're going to check the lips and the teeth, and the lips should be in the midline symmetrical and the skin intact. It should be pink and moist, and for the coloring consistent with ethnic group and race. There should no unusual odors rather. So the teeth should be white, pale, yellow to yellow, not loose with good occlusions, and in a good repair. So now we're going to check the lips of our patient. So ma'am, tulog lang sa akin, ma'am ha. I'm going to check your lips po. Can you smile po ma'am? Can you show your teeth? Can you open your mouth? Okay. So as we inspect, the lips are intact, no wound and consistent in color, and the teeth is pale, yellow, and not loose with good occlusion. So, that is the normal findings. And now we're going to check the gums and the buccal mucosa. Normally, it should be the buccal mucosa. It should be pink, moist, and intact mucosa. The color variance is acceptable if consistent with the patient's ethnic groups and race. For the instance, the dark stippling in dark skinned patients. So now, ma'am, we're going to assess your buccal mucosa. I-inspect ko lang po ang buccal mucosa niyo with in your gums po at in your mouth po. Can you please open your mouth po, ma'am? Okay, can you please show your tongue po? Normally, for this assessment, for the good visualization, we can utilize using the tongue depressor for us to see the buccal mucosa. So for my case, normally the buccal mucosa is actually, you can see it, and that is the normal findings. And now we're going to inspect the hard and soft pala. It should be intact, and the soft pala is smooth, pink, and the hard pala is bony. So, ma'am, and I'm going to check your pala. Can you please open your mouth again? Okay. Can you please show again your tongue po? Okay. So, as I as I inspect, both of the pala is intact and the smooth pala is pink and moist, and the hard pala is bony. Now we're going to observe the uvula. The patient should say in a prolonged manner and note the symmetrical rise of the uvula. It should be the midline and it should be pink and moist without the lesions. So in this assessment, we're going to utilize using the pen light to see the uvula. But if you can see it without the pen light, it should be okay. So ma'am, today I'm going to assess your uvula po. Can you, this time you should open again your mouth and show your tongue. Is it okay po, ma'am? Okay. Can you please open your mouth po, ma'am? And when open your mouth, can you please say in a prolonged manner?
Yes.
Okay. And also you show your tongue din po. Okay. Say po, ma'am. Okay, again po. Okay. So now we're going to assess the gag reflex to test the cranial nerve number 10. To test the gag reflex by touching the posterior pharynx with the tongue depressor. So normally, the gag reflex will be intact. So in this part, we have to warn the patient. So ma'am, ang gagawin ko po ngayon ay I'm going to touch your tongue po using the tongue depressor. Um, sa procedure na po ito, ma'am, sigurado po ako na hindi po kayo magiging komportable, pero sisikapin ko po na maging madali po itong procedures na ito, at sigurado po na madidiwal po kayo sa gagawin kong procedures po, sa assessment po. So, is it okay po sa inyo, ma'am? Okay, so I'm going to test po your patience. So, can you please open your mouth po, ma'am? And can you please come po? So, normally, the gag reflex of our patient, the cranial nerve number 10, is intact, which is a normal findings. And now we're going to inspect the tonsils. It should be symmetrical, pink, clean, and crisp. So, the crisp may have normal variations of small fluid particles, which is the tonsillar pearls, or scant amounts of white cellular debris. And now going to proceed to the inspect of the tongue. It should be pink and moist. Coloring may vary consistent with ethnic groups and race. So, mucosa should be intact with no lesions or discolorations. So, ma'am, can you please move your, show your tongue po? Show your tongue po. Okay. So, the tongue is pink and moist and no lesions and decolorations, which is the normal findings. Now we're going to test the tongue strength for assessing the cranial nerve number 9 and 10. We're going to ask the patients to protrude the tongue and move the tongue from side to side. So the client should protrude the tongue medially and there should no atrophy, tumors, or lesions. And it should not asymmetrical as well. So, ma'am, can you please move your tongue side to side po? Okay. So, the patient cranial number 9 and 10 is intact and which is a normal findings. Now we're going to check the test sensations to assess the cranial number 7 and 9. Normally, the client identifies the correct flavor, which is the substances of the taste, like sugar and salt, then or coffee. What we did in the smell sensations is the patient should close her eyes and take his tongues to identify and distinguish the different test sensations. So, ma'am, can you please so ma'am, in these procedures, you're going to close your eyes and ipaba mo lang ang dila mo, ma'am, kag ano lang ko, ma'am, mag-identify ka sang kung ano na flavor ang na ano ko sa iyo. I-state mo siya kung ano siya na flavor po. So, for these procedures, we're going to utilize the cotton applicator. If you don't have a cotton applicator, we can use the cotton buds or the tablespoons. So now we're going to first we're going to take we're going to so ma'am, can you please take your tongue out po, and then we're going to close your eyes po and identify if it is sweet, sour, or bitter. Okay po. Can you please close your eyes po, ma'am? Stick your tongue out and identify what is the substances you taste. Is it sweet, sour, or bitter?
Sweet.
So, what you might think is it?
Sugar.
Okay, that's right. So now we're going to proceed to another sentences, taste of sentences. So, again, ma'am, can you please stick your tongue out? So what you might think is that?
Salt.
Normally, the test sensations of our patient, the cranial nerve number 7 and 9 is intact, which is the normal findings. So now we're going to inspect the appearance of the neck. Inspect the neck from the neutral positions. The patient should be hyperextend when the client while the patient swallowing the water, and the neck should be erect, midline, no lumps or bulges or masses are present. So, ma'am, can you please hyperextend your neck po? Okay, so from this time, can you please swallow water for that so I can expect for your neck po? Okay. So the neck is erect and midline. No lumps or bulges or masses are present, that is a normal findings. So now we're going to palpate the preauricular and postauricular, and tonsillar, submandibular, and submental nodes. So first we're going to instruct the patients for this procedure. So ma'am, I'm going to palpate your lymph nodes, which is located from your neck po. Ang nga procedures, ma'am, hindi siya masakit, pero you can tell me if I will palpate your lymph nodes, if there's a tenderness. You can tell me if masakit po siya. Okay lang po ba, ma'am? So, ma'am, mauna po ako dito ngayon in front of your ear po. So, we need to palpate first the preauricular. So, masakit po ba, ma'am? Alright, so from the time, we're going to ask the patients if the tenderness is noted. So, now we're going to proceed the posterior auricular. So, masakit po ba, ma'am? Alright, so next we're going to proceed to the tonsillar node, which is located at the jaw, at the angle of the jaw. So, masakit po ba, ma'am? Okay. So, this is the tonsillar node. This part of the jaw is the part of the tonsillar node. Now, we're going to proceed to the mandibular. Masakit po ba dito, ma'am? Okay. Now we're going to proceed to the submental under the chin. Ma'am, masakit po ba dito, ma'am? Okay. Now we're going to palpate the trachea, and of course we're going to place the thumb on the trachea in the suprasternal notch. Then we're going to move our fingers laterally to the left and to the right in spaces bordered by the clavicle. So the anterior aspects of the sternocleidomastoid muscle and the trachea. So the deviation to one side and indicates possible neck tumors, the thyroid enlargement and enlarged lymph nodes. So we're going to instruct the patient again to this procedure. So ma'am, our next procedures is we're going to assess your trachea po. So I need to touch your neck, ma'am, and your clavicle. Is that okay with you po, ma'am? Okay. So this is the posterior notch here, and then we're going to move here, and then we're going to palpate. Okay. Okay po. So the trachea is intact and non-tender and mobile. So this procedures is normal findings. If enlarged, we're going to auscultate the thyroid gland. As we auscultate, we should the thyroid gland should be not no bruit. So assuming that the patient is suspecting an enlarged thyroid gland, we are going to use the stethoscope to assess that there's no presence of bruit. So ma'am, I'm going to I'm going to assess your thyroid gland po. I'm just going to use the stethoscope to assess for any bruit sound. Okay lang po ba yun, ma'am? Okay. I'm going to use the bell of the stethoscope to determine the high pitch of the sound. Ma'am, mag-assess lang po ako ng thyroid po. So, the presence of the thyroid is no fluid, and that is the normal finding. Next, we're going to palpate and auscultate for the carotid arteries. First, we're going to palpate the carotid arteries. So the carotid arteries is located here near the neck. So first, we're going to instruct the patient that what are we going to do. So ma'am, I'm going to palpate first your carotid arteries, which is located here near the neck po. If it's okay with you, ma'am, if I palpate po. Sige po. So, the carotid arteries is elastic and not bounding, but it is palpable. And of course, in this case, we should going to score it. We're going to score it if it is a +2. So in my case, my patient is the pulse of my patient is +2, which is a normal finding. So we're not going to palpate the carotid arteries at the same time because it might cause perfusion in the brain. So now next we're going to palpate the right side of the patient's carotid arteries. So ma'am, magpalpate lang ako ulit dun sa kabila po, ma'am, ha. So the findings are still normal what we did in the right side. Next, we're going to auscultate the carotid arteries using the stethoscope and the bell. It should be a regular rate. We're going to assess the if there's a blowing or swishing sound that may indicate in the fluid. So it should be regular in rate and rhythm, strong or +2, and bilateral and symmetrical. So, ma'am, again, we're going to assess your carotid arteries po using the stethoscope. And I'm going to use the bell to check for your carotid arteries. I'm going to check if there's a bleeding. So, there is no blowing. So, as I auscultate, there is no blowing or swishing that may indicate in the bruit. So, that is indicate that is a normal findings. And now we're going to assess the hands, the arms, and the fingers. So first, we're going to inspect the upper extremities and test the shoulder strength, shoulder shrug rather, and the ability to turn the head against the resistance of our cranial nerve number 7, the cranial nerve number 11 spinal. So normally, movement should be symmetrical with the patient moving against the resistance without pain, and normally there should be plus 5/5 the strength for both trapezius and the sternocleidomastoid muscle. So asymmetrical, diminished, absence, movements, pain, and lateral or bilateral weakness indicates the cranial nerve number 11 damage. And now we're going to inspect the upper extremities of our patient. So the upper extremities of our patient is symmetrical and normal, which is the normal finding. So now we're going to assess the shoulder strength of our patient. So ma'am, you're going to shrug your shoulders against my resistance. You should going to shrug your shoulders so against my resistance po. Go po. The patient's muscle strength is a plus 5/5. It is a symmetrical and bilateral in strength, and there is no pain noted. So, which is indicate that is a normal findings. Next, we're now going to assess the epitrocular lymph nodes, which is located in the near portion of the arm. So, ma'am, may I borrow your, can I assist your arm po? This side po. We're going to palpate the arms of our patient. Masakit po ba, ma'am? Okay. Another hand po, ma'am. Dito po, masakit po. Thank you po. So the epitrocular lymph nodes of our patient is the non-palpable and non-tender, which is the normal finding. Next, we're now going to palpate the brachial pulse. So the brachial pulse, we should note if it is a equal. We should note if it's we should note the strength, and also we should going to note if it is a bilaterally. So, now, ma'am, we're going to assess your brachial pulse po, if it's okay po with you. So, we're now going to locate the brachial pulse of our patient. So, the brachial pulse of our patient is not bounding. It is a non-tender, and it is a plus 2. Next, we're going to proceed to the at the right side of our arms of our patient. So, ma'am, I'm going to palpate them po, ha? So, the brachial artery of our patient, still, it's not bounding, it's non-tender, and it's a plus 2. So, and then we're now going to first palpate both the arm of our, the brachial arteries of our patient. So, ma'am, I'm going to palpate them po both po. So, the patient's brachial pulses, the both brachial pulse is not non-tender and not bounding. It is plus 2, it is a equals plus 2. So also the strength is equal. So which is they are normal findings. And then now we're going to proceed to test the range of motions of the elbow. So, by having the patient flex and extends the arms at elbow, supinate and pronate the elbow. So, ma'am, gayahin niyo lang po yung ginagawa ko po. First po, i-flex niyo po yung kamay niyo po. Then, extend niyo po. Then, pronate and supinate. So, thank you po, ma'am. In my case, the patient is able to do the procedures, and and her elbow is with the full range of motions, which is the normal findings. And now we're going to palpate the ulnar and radial pulse of our patient. The radial pulse should be bilaterally strong, and of course it is plus 2. The arterial walls have a resilient quality or bounce that the ulnar pulse may not be detectable. So, ma'am, I'm going to check your radial pulse po. And then we're going to check your ulnar pulse po. Another hand po, ma'am, as well. So the patient's radial pulse is strong and not bonding. And of course, it is a elastic and plastic. And of course, for the ulnar pulse is not detectable, and also is not bounding. So which is a normal findings. Next, we're going to inspect the fingertips for nail clubbing by performing the Shamroth test. It should be the nail clubbing indicates the perfusion. So, we're now going to instruct the patients what you're going to do. So, ma'am, what you're going to do is to ipagdikit nyo lang po yung kamay nyo ng ganito. To test if there's a nail clubbing or there's no diamond. So in my case, there is no the nail clubbing of my patient is there's a presence of a diamond window, which is indicates the normal findings. Now we're going to palpate and assess the capillary refill type of our patient. Capillary beds refills and their capillary beds refill rather. Therefore, colors returns in 2 seconds or less. So, how to perform this is we're going to pinch or slightly squeeze the nail bed of our patient, and we're going to observe the pale, and if it is in the 2 seconds, if it is, you're going to back into normal like pink color. So, ma'am, today I will going to pinch your nails po, your nail bed, and I'm going to inspect if it is if it is mag-refill po siya in a 2 seconds po. So, masakit po ba ma'am pag pinch ko? So, the capillary refill of my patient, it is a 2 seconds, which is the normal findings. Next, now we're going to test the range of motions of the wrist of our patient. To perform this, the patient should be flexed and extend her wrist, and then we're going to instruct how she going to hyperextend, and after that she's going to perform the ulnar division and radial division. So, ma'am, gayahin niyo na po yung ginagawa ko po. First po, position your hands po like this po. And then, wrist down your wrist po. And back it to the normal position. And then, hyperextend po. And after that, we're going to deviate your ano po, like this. And then, we're going to perform the ulnar and brachial. Ulnar and brachial. So, the wrist of my patient is within full range of motions, which is indicate the normal findings. And then we're going to proceed to test the range of motions of the fingers of our patient. Of course, the patient should be going to abduct and adduct of the fingers, which is she's going to flex the fingers and extend the fist, and we're going to hyperextend the fingers. So, ma'am would also the same manner how to we assess the 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 wrist of our wrist of the finger wrist of the patient. So, ma'am, what are you going to do is gaya ng pong ginagawa ko. First, you're going to normal position po. You're going to spread your fingers po like this, and then going to back po and like this, and then make flex the your hands po and make a fist, and then balik po ulit sa normal, and then you're going to hyperextend your fingers po like this po, like this. So the patient's fingers is with the full range of motions. Next, we're going to do is to test the rapid alternating movements of our patient. So, we're going to assess the patient's coordination. So, ma'am, I want you to do po is you're going to place your hands po in your lap, and then I want you to do is to tap your lap po in a alternate manner like this po sa pinakamabagal at pinakamabilis niyo po. You're going to tap in your back portion of your hands or and the front motion po like this po sa pinakamabagal at mabilis po. So mabilis po, ma'am. Sa pinakamabagal niyo po. So, the patient's coordination is good and alternating the hands, which is just is a normal findings. Next, we're going to test the light sensations, the arms of our patient, and the hands, of course, and the fingers, utilizing the whips of cotton. So, what we did, we're going to what we did earlier in the face. So, we're going to do that manner. So, ma'am, in this assessment po, you're going to close your eyes and you're going to tell now if you feel the sensations of the release of the cotton in your arms po. Okay lang po. First, ma'am, please, I'm going to close your eyes po. And tell now if you felt the waves of the cotton.
Now. 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 Now.
So, the patient's light sensations is intact, which is the normal finding. So, now we're going to proceed to the sharp and dull sensations in arms, hands, and fingers, utilizing the paper clip and of course we're going to ask the client to pinpoint where's the sensation is felt. In this assessment, we're going to pinch the hands of our patient and by the sharp and the dull of the paper clip. So what we what we did earlier in the face sensation. So ma'am, we're going to we're going to identify if it is a sharp or dull. So the sharp is ito po and the dull sensation is ito po. So in this assessment po, you're going to close your eyes again po, and then you're going to ituro niyo po kung saan po yung ituro niyo po at i-identify niyo po kung sharp or dull po yung nakuha niyo po. So sharp,
Dull. Sharp. Dull.
So the patient's sensation in sharp and dull is intact. So which is the normal findings?